Hi, my name is Maria Seaton. I'm with Poets Walk. I'm a community relations counselor here, and we are doing a discussion on benefits today to discuss many matters that prospects, many families have concerns about. We're going to be addressing VA benefits, Medicaid, Medicare, long-term health care, and we're hoping that this is going to be good information out to the public. So I'm now going to introduce you to Valerie Hobson-Bell, and she's going to introduce the rest of the ladies here. Thank you and welcome.
Thank you, Maria. So good afternoon. I am very pleased to present to you two professionals who are going to cover the topics that Maria spoke about. The first one is Sharon Arcardo, and she's with Innovative Insurance Group. She's a broker, so she's going to be able to answer questions regarding Medicare, Medicaid, and I believe some long-term care insurance questions as well. So, and then we have Meg Pemberton, who is an RN, and she's also a care manager, a certified care manager. She's with Elder Care Connections, and that's local as well. So she will definitely be able to talk to you on the topic of what is long-term care. So is that in-home care, home health, assisted living, nursing home? And then Meg also has the expertise to talk about some VA benefits as well. So I hope that helps.
Welcome.
Thank you. Thank you. Glad to be here.
So should we start off with Meg?
Sure, sure. So I'm happy to jump in and kind of talk a little bit about what long-term care is. What does that mean? Because that's a pretty big umbrella of, what can happen to families and seniors as they, traverse the aging journey, if you will. So a lot of people want to know, how do you start? Where do you go? Mom or dad are starting to show signs of failing one way or another, and they need assistance. Where do you go? Who do you turn to? And what's the starting point? If they just need a little bit of care, can often be managed through folks who come into the home to help. And that can be done through, whether it's family, but we know that there's 45 plus million family members across the nation caring for free for family members at great detriment to their own health and pocketbooks, if you will. But there are agencies where you can hire such caregivers, and you can certainly, through word of mouth, there are people out in the community who have themselves for hire, either through friends, etc., or there are websites where you can find them. And these are folks that are trained to be either a companion or personal caregiver, so that they can provide that companionship for your loved ones, so that you can go to work and do what you need to do. And if they need some level of assistance, whether it's to get up, get dressed in the morning, make sure they've taken their medications, etc., they can do that for you as well. And that companionship shouldn't be negated, because we're learning now so much more about isolation and how bad that is for seniors. It's actually killing them at a rate that's equal to cigarette smoking. It's pretty significant. So sometimes you move beyond that. Sometimes it's just what you need, but sometimes you need more. And when you start needing that care around the clock, 24/7, it can be very costly to do that in home. Very time consuming just to keep the team of folks in there, because it's not one person necessarily. I come from the hospital background. From a productivity perspective, I can tell you it takes 4.5 bodies to do that work 24/7, and that's just 24/7. We're not talking about vacation time. So it's a lot of people. So it adds up very quickly from a cost perspective. Hiring on your own, you may find folks for as little as $12 an hour, or as high as $20 an hour. I'll share, that old adage, you get what you pay for, something to think about. From an agency perspective, in Fredericksburg, you're going to pay about $25 an hour on average. And agencies are all different about what they offer. Some will have a minimum number of hours that you're required to use. You've done this. Some don't. Some will just come in and make sure mom or dad gets to their physician's appointment and gets home safely. So they offer a variety of services. Some will offer some skilled care. Oftentimes, if your loved one has a wound, you may need a nurse to provide the care. They'll have a nurse that can come do that. I caution people to think about the names of the companies you're connecting with and be careful about what you are looking for and asking for. So the care that I'm talking about in the home is not your traditional home health care that people think of. So a lot of agencies do call themselves home health care, when all they're providing honestly is that companion and personal care. That's not nursing care. So your traditional home health agencies are those that provide nursings to come out, do wound care, tube feedings, those sorts of things, and they may have some assistance that will come 1 or 2 times a week, but it doesn't provide the kind of care that, say, and I hate to throw out names because I'm not saying anybody over the other. There's many out there. So Visiting Angels, Health Instead, Comfort Keepers, all of them. And there's many others. So that's what they do. Sometimes that's not quite enough. When you think about 24/7 care, that's very costly, $25 an hour. And it actually will cost you more than a bed in assisted living or a skilled nursing home, depending on what the costs are. Some agencies charge you more overnight, some don't, so very costly. So then you start to think about, well, maybe mom and dad or dad need to be somewhere else. And I was listening to your story, and I was right there with you. And my dad, before his Alzheimer's became really bad, we asked him, what did you want to do when mom passed, or if she passed first? And she did. He wanted to come live with me, and I couldn't do that. And I had someone very smart in our community who's still with us caution me on that, because when Dad was diagnosed, she said, well, Meg, what's your plan? I said, well, I'm a nurse. Dad's coming home with me, of course. And she said, don't do it. It'll be a great detriment to your family life, your married life, and to your health. So ultimately, I did have to place him. So the guilt is strong, but you know, you have to acknowledge it, and you learn to deal with it. So you start to look for places, and oftentimes we start with assisted living. And again, you know, Pat Holland, who's someone in our community, will tell you that all of these places have their own personality. And one personality may suit one and maybe not suit another. So you want to do your due diligence and kind of look at not only cost, but go look at the facilities, talk with people, talk with other residents and families to get a feel for, is this the right place for mom or dad? So assisted living comes at quite a cost, but as I said, it can be less than that 24/7 care in your own home. And there's a wide variety and range in cost. In this area, your costs are going to start at about $4,500, and that's basic, low, you know, and then your costs increase with level of care. Maria can speak more to that.
So where does Medicare and Medicaid come into play for someone that is looking for in-home care?
Okay. So from Medicare comes into play when you are hospitalized or need that care pays, you know, and you'll speak far more on that, but Medicare is not going to pay for non-medical in-home care. It's not going to pay for assisted living. Skilled care, which is the next level up. So if you move beyond the ability of the assisted living facility to care for your mom or dad, and you're thinking about skilled care, that's where the nursing staff is available 24/7 around the clock. They can do the skilled care. And for some folks with significant dementia and behavior issues, that's the next level of care. Medicare will pay for up to 100 days for care in there. And it's the first 21 is they pay zero, you pay zero. After that, there's a copay. And it's 100 days per calendar year or it's not per event. Per calendar year, so that you kind of tally up. But I have to ask.
There is a max.
There's a max, but do you start over with the 21 days for each event?
It depends on how long the distance is as far as one event to the other event. If there's a major gap in there, then it would be 2 separate events versus closer together.
So, you know, Medicare will help to some degree. I do have a client right now in this exact situation, so where do you go next? Particularly if you don't have the funding to pay out of pocket, then that's when Medicaid kicks in. Medicaid is different from state to state. It is funded by the state. You know, it is part of the CMS government funding, but it is determined by the state. And that is something that you have to apply for, and there are eligibility requirements, both for income level and asset level. And the rules were kind of confusing. It's very easy to go online and fill out the application, but you got to make sure of a lot of stuff. And I've had some recent experience with a family that didn't disclose funds until the very day we were signing the paperwork. And they said, oh, by the way. And so one of the big things that families try to do is not hide, but protect funds for future generations, for their legacy. And Medicaid wants to know what that money is and what you've done with it, and they will look back 5 years. Now, they don't do that on everybody. There's like a sniff test, I don't know what it is, but I mean, they're not out there to find it. But if for whatever reason they see something or, and in this case I did, he was a lawyer with no money. What happened? At the last minute, they disclosed that there had been a gift of funds. So it's like, what happens then is if you submit the application, they discover it, they will deny you for a period of time based on the amount of funds that were hidden, if you will. So there's a lot of nuances. You have to provide a lot of documentation, but Medicaid with them, that's what happens. And it is something that you earn. So while it's difficult to get, you've earned it. You know, as you've worked over all those years. So it is there to provide you care. I have many folks who don't want to go on Medicaid because they feel like it's, you know, I don't know, there's a stigma to it.
It's a pride.
It's a pride
It
thing.
really is.
It really is. So yeah. So that's kind of it in a quick nutshell. I hope we didn't go too fast, but, and I may have missed a few things.
Well, no, I think you covered quite a bit of it, and you know that one of the things about Medicare and Medicaid is that, again, it is very limited to what you can do in a long-term care facility. And if you don't qualify for Medicaid, then you have the other options available. And again, when you supplement or get a Medigap or a Medicare Advantage plan, they are limited to how much they cover, and then you're on your own for that extra exposure. So long-term care is really important as far as the policies that you can purchase to cover if you go into a skilled nursing facility or a long-term care facility. And then it gives you that opportunity or that option to stay at home or have the facility available.
That's with long-term care.
With the long-term care,
And
yeah.
there usually are caps with long-term care.
There is, and I know enough about them. There's a lot of different things that you can purchase. There's ones that have life insurance. So if you pass, that benefit goes to somebody. If you don't use the long-term care benefit, there's ones that if you don't use it, you get your money back. There's a multitude of different long-term care policies. So it's really important that you reach somebody who is educated in that field and talk with them about your needs. But that's where it's really, really important because the fact that Medicare itself and supplements and binge plans don't cover a long-term facility. Yeah.
When is it too late to apply for long-term care? Like my mom is already in assisted living. Is it too late to apply for it?
Yes, yeah. You have to not be in a facility. You have to be, it's underwritten product, so it would be something that they would ask questions, and there's no, it's not guaranteed that you would be accepted. So you want to do it. The younger, the better, because the premiums are less expensive, and you know, so it will helps build as well that secure amount. But then it gives, again, you have a lot of different options there. But it, again, gives you that option of going into an assisted living facility, going into a long-term care facility, a memory care facility, or being taken care of at home. It will allow that option for your family, which is a lot better than having nothing at all, because then you have any options.
And I think you mentioned something that's really important, is to make sure that you're talking to someone that is very knowledgeable about long-term care, because the variety of products out there is pretty large.
It is.
And there can be surprises. So depending on when you first bought the policy, and I have a recent couple that's done this, they bought it many, many years ago, and over the years it's changed. So one of the things they thought they would have was the ability for assistance that would help pay for in-home care, and when they were ready for that, no, it no longer covers that. They also also thought the benefit amount would be greater than it was, but over time things change. So you really want to be clear on what it is you want and make sure the policies are going to offer that. But they can change over time. So, and they do send you, and they had all the documentation to say they just didn't understand it. So you really want to make sure you connected with someone who you stay connected with and can stay on top of that plan.
Yes.
Yeah.
So it's really important. So I want to I guess I want to go back and just kind of talk about the basics of Medicare and really how you become eligible for Medicare, as well as, you know, what options you do have when it comes to offsetting that deductible and the co-insurance. So as an individual, you can either age in at 65 to Medicare, or you can be under the age of 65 and be disabled. And if you are disabled for longer than 24 months, on that 25th month, you are automatically enrolled in Part A and Part B. When you age in, you automatically get Part A if you have given your 10 years into the system, paid your taxes. It's a free charge to you, or your spouse. So if you're married and you stayed home, or your spouse stayed home and to raise children, or whatever the case, as long as you put in your time, then they would draw from your 10 years. After that, the Part B part is going to be whether you have, there's multiple options. B can be you would actually accept it at age 65, or you can defer it if you have group insurance, if they don't require you to pick up Part B. And then the premium will be based on your income. So if you are, a wealthy person and you make over a certain amount of money based on your tax filings, it will be depending on how much your premium for your Part B will be. And every year they do look at it. So if you are retiring and of course you had a really good year prior years, then that premium would be higher. But then the following year everything goes down because you're no longer working. Then they will adjust that premium as you go along. Once you pick up Part A and Part B, A is hospitalization. It covers your things like inpatient hospital stays, skilled nursing facilities, facilities like this where they have that limitation of 100 days. And then you have Part B, that's our doctor's visits and so forth of that, labs, x-rays, those kind of things that fall into Part B. You have to have, there's deductibles with both, and there's a co-insurance with Part B. Okay. The deductible for Part A is $1,364. Part B is $185, and then you have a 20% co-insurance. So if you did nothing more than pick up your Part A and Part B, you would have protection, but you do have some exposure, okay? And that exposure, which is the scary part, is going to be unlimited. In other words, sky's the limit for the exposure part because there's no cap. We're all used to having some kind of group insurance, right, or individual where you have a max amount of pocket. When you have Part A and Part B, you don't have a max amount of pocket. It can be as high as it can go. So there's no limitations there. So where it's important at that point is you got to do something extra, whether it be a Medicare supplement, or as people know as a Medigap plan, or a Medicare Advantage plan. And then of course you have your Part D, which is your drug benefit. Okay, so your supplement is going to be offered by a carrier. You would purchase it from either someone like myself who can enroll you in the plan, or you can go straight to the carrier and enroll in the plan that you wish to. All Medicare supplement plans are exactly the same because they're regulated by the government. So Plan F is a very popular plan. It is going away as of 2020. So it will no longer be eligible once you turn 65 as of January 2020. After that date, if you turn 65, you're no longer eligible to get the Plan F, the Plan C, or the high deductible Plan F. Okay, but they are still available for somebody who is turned 65 prior to 2020 and was maybe on a group insurance, deferred their Part B, and then they're going to pick it up later at that time, so they can still get that plan. But let's just take that Plan F for example. That Plan F is going to cover the deductibles of Part A and Part B, and it's going to cover that 20% co-insurance. So you pay the premium every month to know that you're going to be 100% covered on a Plan F plan. There's no more out of pockets. Okay, so you would have 100% coverage. Then you have to pick up your Part D as in David, which is the drug card. Okay, and the drug card is going to be specific to your need every year. Every year, if you do nothing more, when you have a supplement, you need to look at the prescription drug cards because those formularies change, the co-pays change, the premiums change, the tiers change as to where a drug may be on a tier 2 today, may be on a tier 3 2020. So you always want to look at that option every year. And that's where the open enrollment time frame comes from, in October 15th to December 7th. That's when you have those options to look and change for the new year. Okay, we are in open enrollment right now. So the other option is a Medicare Advantage plan. And that, you had a great question with the Medicare and what Medicare Advantage plans and what they cover.
Mm-hmm.
So I can be very specific. There is a company here locally that has come out with their own Medicare Advantage plan. And they have a zero premium for the cost. There are zero deductibles for the health part and the prescription part. There are zero co-pays for your preventive services. There are zero co-pays for the first 2 tiers on the drug card, depending on which plan you choose. So yes, they can be really good in your statement of too good to be true, but it's really not. They really do exist. And the nice thing with them is that they offer additional benefits. Not only do they have to cover everything Part A and Part B do, because they're incorporating it into the Medicare Advantage plan, they also cover additional benefits. And they give things like preventive dental, and preventive vision, where they give you so much towards eyeglasses and frames if you need them. They give you transportation benefits. There is a carrier out there today that actually, this coming year, they're giving you the option to choose where you can have up to, I believe it's 4 hours a day, I think 120 hours a year, where you can have somebody come into your home and they can just sit with you, play games with you, have a conversation with you. That is one of the Medicare Advantage plans is offering that this year. So that's a great feature, because a lot of these people live out in the country, they don't ever see anybody, they have no way to get anywhere. So that is a wonderful feature to have. They also cover things like over-the-counter products. Over-the-counter.
How about hearing?
Hearing, yes, hearing aids.
Towards hearing aids.
There is some that will cover your hearing test, as well. It gives you so much towards hearing aids. Mm-hmm. So that's a nice benefit. There is the over-the-counter, to go back to that has to do with, you go into the pharmacy area, anything you see that you don't have to get a prescription for is basically what you can purchase with this over-the-counter benefit. It is through a catalog in most cases. Some of them do debit cards, but you would have to, anything that you can purchase there, you can use that for, which is really nice. And it helps with people, especially in low income, that don't have a whole lot of money to buy those extra things. And it's something as simple as aspirin.
Yeah, I know. My mom she has macular degeneration, so the eye doctor wants her to take AREDS vitamins.
Yes.
And those things are like $40.
Yeah.
Yes. So you could use that over-the-counter benefit with the Medicare Advantage plans to cover that type of thing. So, which is great, because it does cover anything health-related. So even like...
and she does take aspirin for blood thinner, yes.
Toothpaste and toothbrushes, because that's all health-related. You don't take care of your teeth, and you can you can get some, some serious conditions with that. So that is all health-related kind of things. Now, it's not going to cover things like toilet paper and that kind of stuff, but that's the kind of things it will cover. So they do provide additional benefits on the Medicare Advantage plans, and the only, and I wouldn't say it's a drawback, but it's an out-of-pocket limitation. So you, with a Medicare supplement, you're covered on the back end. Well, this is where you pay a lower premium, like that $0 one, but you have exposure on the back end for an out-of-pocket. Okay, but there is a limit. One of them is as low as $3,400 a year, and it's all co-pays. So if you don't go to the hospital and only the doctors, you'll never meet that out of pocket. So that's, and then the drug card is included in that as well.
So the advantage aspect of it, that's simply an aspect of Medicare, correct?
Yes.
And go ahead.
No, go ahead.
So at what point does that kick in? Is there a qualifier for it? Can you just recap on that?
Sure. So Medicare Advantage plans, again, when you turn age 65, you can choose that as as an option to pair with Part A and Part B. But the Medicare Advantage plans actually incorporate everything to one. A, B, C, and D, in most cases, are all rolled in as one plan. Okay. There are other ways you can qualify for them. Again, if you choose not to do something when you're eligible, when you've picked up your Part B, and you don't go on a supplement because those are guaranteed issue for a certain length of time, then you can pick up a Medicare Advantage plan at open enrollment, which is October 15th through December 7th again, or at the time when you pick up your Part B, you have a certain length of time to do that as well.
Okay.
So there's several ways you can get Medicare Advantage. The nice thing about a Medicare Advantage, no questions asked. It's a guarantee issue plan. So they don't ever ask medical questions. So no matter how sick you are, you will always be granted the Medicare Advantage plans.
The transportation portion of it, does that fall under that same category?
It does. So a transportation benefit, they have a limit. It's some of them are 20 one-way visits, so that'll be 10 round trips. Some of them are in the 30s or 40s, so it just depends on the carrier. And they are specific to doctors. So whether it's a dentist or a primary care doctor or a mental health provider, they're going to just take you to those specific places.
And some of them, like the newer program that's local right now, is specific to the physician group, the Health
That is
Alliance.
correct.
So you do have to
Yes.
be cognizant of that, because that may make a difference to you if your providers are not all linked with that Healthcare Alliance.
Absolutely.
You'll be, the additional out of pocket or out of network costs can increase.
And you bring up a very good point of that as well, is that Medicare supplements are not network driven. As long as a doctor or facility takes Medicare, they will take the supplement, where Medicare Advantage plans are either HMOs or PPOs. So those are network driven, and they are zip code driven. So depending on which zip code you live in, depends on the choices that you have. So there's multiple factors involved when you're looking at those considerations, as well as what's going to be the best option for you in your scenario. So there's a lot of things to look at.
Right. Okay. So the subject of VA benefits.
Okay.
So you touched on it, Meg, a little bit about the VA benefits. If you're an individual who has Medicare and VA benefits, there are a lot of benefits that they may be eligible for, and the biggest thing is making sure you have somebody that you can talk to ask the questions and to see if they qualify for those benefits. I actually was able to get somebody that now I can call and ask whatever questions I want to know.
And we're going to get that information.
Yes.
from you.
I have her, this is my Bible. But, because I was telling her I get these benefit questions all the time. And they do make accessible to the individuals in the communities. They come out, they sit in a certain location where VA individuals can come in and talk with them individually. Unfortunately, it's how do you know they're there? And, what time they're going to be there, what day they're going to be there. And then, if that person can actually get to them, because I do know that it's a struggle. Some of these people are homeless.
Yes.
And when they're getting their VA benefits. So, they're, trying to get to them is tough. So having somebody you can call and ask questions is huge. I may not always know all the answers, but if I don't, I will get them, or give you somebody that will know the answers. But the VA benefits are wonderful. They have the individual has the ability to use the VA along with their Medicare. And in some instances, they might also want to pick up a Medicare Advantage plan, because they may not have the ability to go always to the VA. They want to do some things locally. So the Medicare Advantage plans will allow them to do local things and then still use the VA as a secondary coverage, which is really nice.
How about applying for VA benefits? So you've got an adult child that is now taking care of their elderly parent, and they are now learning about Medicare, Medicaid. They really don't know. They know they're headed in that direction
Sure.
someday, but they're not quite there yet. So they're lacking in some of that knowledge, which is I'm in the same position. So and they find out that their parent qualifies for VA benefits. What's the first step that they should take?
I think just reaching out if they know that they're qualified, reaching out to a local facility that I know there's one in Richmond that's not local, but that actually works with the individuals, and they have people locally that they can talk with. Charlottesville, they actually work a certain territory, so everybody has their own situation, and so what I always recommend is calling them first and finding out where they go, what they need to do, who they need to talk to, and that process.
There is a Veterans Administration office here in Fredericksburg. Is that correct?
You have
Yeah,
two.
that's
Are they
it.
just the clinics, or are they actually a full-fledged?
You can go
full-time.
in and make your
Excellent.
applications there. I've referred
Excellent.
several folks there, because just even understanding whether or not you're eligible is very confusing to some. So there are, eligibility requirements based on wartime service, whether you were there or not, is it just one day, and then the dates, you may think, when we looked at recently, the date the Korean War ended, but actually it's 2 years past that they include in that time for wartime service for the Korean War. So there's a lot of, rules, if you will.
Oh, and what is it, if I'm saying this wrong, the Agent Orange?
Yes.
Is that it? They actually have new benefits for people who were exposed to that they don't know about.
Yeah.
So that's where it's really important to go into these facilities or have somebody that you can call to ask the
Do you
questions.
have to have an appointment when you go, before you go?
I always
Or can you just
caution
walk in?
my folks to call first, nobody's ever come back and said they couldn't get the appointment, or,
Kind of like Social Security,
I haven't been to the offices myself.
I was gonna say,
The
Social
DMV.
Security, go
Yeah.
online. Go online to Social
Yeah.
Security and enroll in Part A and Part B.
Yeah.
Don't even deal with the office.
Yeah.
But
Yeah.
and I think it depends on where you live, because I do know, like in Culpeper and Orange County, those areas are more rural. They don't have a local office, so they have somebody who comes in, and it's walk-in basis. It's first come, first serve. There is no appointment making at
I
that point.
suspect it's the same here.
Yeah.
I just always say
I
call
don't really
first.
know, like I was kind of interested in the veterans one, like my dad served during wartime. But I don't know what you call that exactly. What specific benefit is
Right.
that?
So there are different ones. So one of
Yeah.
the big ones we hear about often is aid and attendance. And that's what will get you some help in the home to care for a senior, veteran
Well, I
that
was
needs
thinking
help.
there's one that kind of would give, like, my mom, maybe like $1,200
Yes.
a month.
Yes.
So what is that called?
And I can't think of what they call it now, but there's a little known benefit that a lot of people don't understand they have access
Yeah.
to. And that's why, and I don't know enough to counsel someone on that. And that's where I'd say, yes, you may qualify for these benefits, and spouses may. So you want to actually connect with the specialist there. And they do have folks. And there are actually rules about what I, as a layperson, if you will, even in the role that I serve, can only share but so much. I can't tell you that I'm a specialist in that. You can have training and get certified for that, but you definitely want to speak to them, because as I tell everyone,
And you guys have a number or contact?
Yeah.
I do.
I always want to make sure you get to the right person and get
Yeah.
the right information. Like you, if I don't know, I'm going to help you find
And I'm
the
thinking,
answer.
okay, how am I going to find all that information out about my dad? And I mean, I do have some that they have. I don't know if it's the right information, but can you just tell them like his name and social security number, and
need
can
to
they
come-
find it out? Or
You will need to provide his discharge
I got
paperwork. So
that.
if you've got that, you're good to go. So you're going to have a serial number. You're good to go.
okay,
And they'll be able to research, service dates, etc. from that. But that
I
is
wonder
what
how
they're
long
going
it
to
takes to
first.
get the benefit.
That I don't know.
You know?
Yeah, that I have no idea either. But just starting the process and knowing what's there for them.
Yeah.
You know, can I share a story? An individual that I had met who was referred to me because of his wife, who was a quadriplegic, and he took care of her 24/7, except for 2 days a week. He'd have somebody come in, and he ended up having surgery on his leg. I wasn't sure if it was a knee surgery or what it was, but he was in a wheelchair. So now he is paying out of pocket 100% for this woman to come in for 24/7.
Wow.
Yeah. He has VA benefits. He had no idea how to start the process, that they would even pay for it. And so one of the ladies in our wonderful organization that we belong to helped me out. She called him, she took care of it, and now he's getting it paid for at 100%.
Oh, wow.
Yeah. So it's a great,
That's a big deal.
just knowing the people to call, that's a huge thing.
And never be afraid to ask.
Exactly.
You need help, reach out, because there are, even beyond the VA and Medicare, there's resources in our community that we can help you.
It's hard to know where to start when you're out there by yourself. Like I said, I felt like I was out there in the middle of the ocean and I just needed somebody to throw me a lifeline. I just felt like I was going under, and so who do I call?
That's the challenge that we're running into. I belong to a couple of the Aging Together groups. There's one here in Fredericksburg. There's several. They're all over in every county. And one of the challenges we have is how to notify individuals of all the things that are available to them.
Yes.
Do we have this big, massive book where when somebody over 65 looks at it, it's going to be so confused and so overwhelmed because there's so much information in it? Yeah. Or do you get flyers, and then there's not enough information? So that's the challenge that we have run into, is how do you notify them? That's the thing. Yeah. How do you get the word out of all the things that are available? So that is one of my goals.
So are you going to give us your name and number?
I will, absolutely. Yeah. One of my goals is to learn as much information about what's out there in our communities, so that when I'm sitting down with these individuals and they need something, I have that information to give them. Yeah. Even if it's a contact name.
And you were talking about like the insurance and stuff and all these other, I told you, like the things they're showing on TV now, and now you need to enroll, and you could pay $0 plus, but have these more benefits and stuff. It's like I really hesitate to even change anything that my mom has, because when she had her stroke, they helicoptered her down to VCU. I think I got a bill, or saw a bill, for like $80,000 just for the helicopter ride down there. And I'm going, oh my God, and I'm just going cha-ching, cha-ching. But in the end, everything was taken care of, and so I hesitate to even change anything, even though she's deaf in one ear. There's nothing they can do. She has a hearing aid for this ear, so that's not that great, but it's something. And I'm thinking, well, will I mess up these other benefits if I change this here?
And that's where it's really important to have someone like myself who's educated enough to know the questions to ask, because it's really going to depend on what does your mom have. Is she eligible for Medicaid? And if she is, then she's wasting her money on a Medicare supplement.
Well, does she have to have no home and everything before she qualifies for Medicaid?
Yeah,
or
pretty
do you have
much.
to be pretty much destitute?
Yeah.
That's what I thought.
Yeah, and like Meg said, they look at your assets, they look at your income. And so, unfortunately, a lot of people, continue on and they just keep the assets, and we have to learn to move them as we get older. Move the assets so that in time, 5 years has gone by, and hope and pray nothing happens, but if it does, those assets are no longer in your name. So you can take advantage of other things that are available.
My mom's 94, so.
Yeah. So the questions are huge. What to ask, and then you go from there as to what would be the best options to, does she save her money and do a Medicare Advantage plan, knowing that she has a cap if she needs it, or to stay where she is. I am a huge Medicare supplement advocate. I think they're great plans because you pay a little bit more up front, but you got 100% coverage on the back end. So, and I've never seen anybody get a bill.
You brought up something that's interesting, that in our day and age, for the boomers and us, we were our parents were raised up And we've been sort of raised up that we need to amass these fortunes, our legacies, if you will, so that we can share them and pass them along to our children. The reality, though, now is that our parents' generation died earlier.
Yeah.
We are living longer. You know, hopefully we're taking better care of ourselves. We've learned our lessons. So we're not dying at 65 and 70 anymore. Your mom is 94. So you have to really think differently about the legacy you're building and making sure that you're putting enough money aside to outlive your retirement, to be able to do the things you want to do in retirement, but also to make sure there's money there for your care.
Yeah.
So my children, we joke with them a lot, you know, they're like, we're going to get your home, and what are we going to do? I have 2 daughters, and one wants to live in the home, the other one's in Texas. She could care less. So Sarah was like, just shocked when she learned she'd have to buy her out. But then, even more shocked to learn, well, you know, mom and dad may not stay there. We may sell it and move on. And you have to be, you know, no longer is it a given that your legacy will go to your children. We want that. But the reality is often we have to turn that legacy back into our care as we age.
My goal is to use it while I'm alive with my children.
Yeah.
That, you know, when I'm dead, they're on their own at that point.
But, you know, so that's where that whole 5-year look back comes
Yeah.
in. People, you know, I still meet them where we, you know, we turned the house over 10 years ago to our son, so it wouldn't have to be used. And
If I knew now what I should have known then,
Sure.
exactly.
you know. But you know, and talking to you about that long-term health care, I have long-term health care,
Okay.
but my husband does not.
So do you have a plan that incorporates both of you? Because that's one that you can, as a husband and wife, get one that if one uses it, you know, if one doesn't use it, but the other one needs it, so it can go either way.
But mine is that if I don't use it, you get it back.
Perfect. Or could your spouse use it?
I don't know.
That's
But you know, he has health issues. I don't.
Right.
You know, or mine are minor or under control, whatever. So can you have too many health issues to get long-term care?
That would be a good question for somebody who specializes in long-term care. I'm not sure to what degree the health, you know, issues would be. I know what, as a Medicare person, if on a supplement, I know what they're going to take and what they're not going to take, and there's a 5-year look back. So it just depends. I mean, he may have some health issues, but are they severe issues? Are they chronic issues? So those are all kind of things that you have to look at.
There's another thing to think about here. Does he have life insurance?
Yes.
Well, we had life insurance with work. So it's that declining, you know, which it'll be very minimal
Yeah.
when it does get to the basic. But we always figured, okay, well, we've got enough money in savings and stuff. But, you know, now seeing the issues I've gone through with my mom, hey, that can
Well, there's
go
life
in a heartbeat.
insurance. There's life insurance policies out there that will actually, if something were to happen and you became chronically ill and you have a life expectancy of less than 2 years, they will allow you to use your death benefit up to a 75 and 80% in some cases
for the care.
while you're living. Yes.
And then there's another one. I don't know. You probably know more. The viatical. So is that the one that does, as you said, or is that the one that you can actually, you sell to a third party and you get the money then?
Yes, I think that's the way it works with that one.
So there are options for folks who reach a certain age where it may become difficult to purchase long-term care insurance. We don't have long-term care insurance, so we have life insurance and we plan for things other than, and our financial planner keeps saying, don't worry about it, you're in better shape than someone, you know, and we're fortunate. But when it first, you know, I was of an age where they started offering it through work and everything, people were very hesitant about it.
Well, they weren't real creative with their long-term health care when it came out, and it was just very expensive.
Exactly.
Yes.
And if you don't use it, tough.
Yeah,
I know.
You know,
exactly.
and who can afford that?
Exactly.
So,
So it's changed now.
It
Yeah.
has.
Absolutely.
they've gotten to where they've got a lot more, you know, where
More
you feel
bells
like,
and
oh,
whistles,
yeah,
more attractive for people to
if I don't
purchase
use it, I get it back. Okay, I
Exactly.
can deal with that.
Exactly.
You know.
Yeah. And it goes to your dependents because something obviously is going to happen to you at some point. So
Interesting about that long-term health care.
Yeah.
there's a lot of great things out there today, and you can. I mean, there's no such thing as insurance poor, and I do agree that there is that point. But there is just some things that you, as an individual, need to have, and life insurance for sure. and long-term care if you're able to get as well, because then that gives you options.
Yeah, kind of, since I've had to deal with my mom and everything, it's really shed a whole new light. Because I've always said, oh, we'll just take care of each other and that'll be fine. But I'll tell you, it's like you give up your life
Yes.
to care for someone else. I mean, I've done it, I've tried my eyes out, I still do.
Yeah.
But it's hard.
Mm-hmm.
It is very hard.
I mean, you can only do it for love, really. It
I
is
hope
hard.
I never have to make that decision. I really do.
I hope you don't.
Yeah.
Well, if I can put that to rest, out of the many families that have sat in this very room, and I've heard so many different stories, I will tell you that when you become a caregiver to a parent or spouse, especially with dementia, I can't tell you the countless stories that I've heard of the caregiver themselves, their health declining, getting a diagnosis of dementia, and actually progressing further into the disease a lot quicker than the loved one. So if that information could be put out there, and I will tell you, I sit in here and I think to myself, my hat's off to all the caregivers, the children that have been doing it for years, the spouses that have been doing it for years. I've seen spouses with PTSD as a result of being a caregiver for so long, and they still believe in that. And I don't blame them to a degree, till death do us part belief. But at some point, that this whole thing needs to be protected, that health needs to be protected, and it starts kicking in somewhere along the line. So my hat's off to all of those people out there. Anyways, this information has been very informative. I wish that it was out there more to the public, available, because I just think it's not something that we all go looking for, and it's only until the last minute that we have a parent or a loved one that's in a particular situation that we're scrambling at the last minute. So does anyone have any last minute questions to ask before we conclude?
Thank you.
You're welcome.
Well, I want to thank all of you for coming today. I'm going to end this video with both Sharon and Meg's information, so that if anyone has any questions on these matters, they can have a resource to go to, at least here in Fredericksburg, Virginia, not unless you cover other areas.
I do, but in all the state of Virginia, actually.
Okay,
Yes.
excellent.
I don't go
So,
quite that far. Fredericksburg, Spotsylvania, Stafford, King George and Caroline.
and we're actually hoping that we can kind of carry this on possibly next month. We're looking into that as well, being that this is just a topic that is not commonly covered. But again, I want to thank everyone for attending, and have a great day.
Thank you.
Thank you.